NPP for the sad story we jadam. Public sector nurses strike cripples healthcare delivery. Now before me baba church umuno. Mama video embra na me nkyere bibi mu nkyere.
Abushua Mami ye friend of Perpetua Ofori Ampofo. Our president of the Ghana Registered Association for Nurses and Midwife. We di paponini. Utrimoti papa. Utrimoti. Unyo ba ye do chechere mai. We mampoyefo. Utrimoti. Unye ni ba ye do chechere mai. Abushua Mami we na ye president Emma Ghana Registered Nurses and Midwives Association. On any penny for. Most of mu grievances. Mu issues am person money aban no entrance and discuss. Tie ye o Abushua tie. Na health minister so etukwan. Okoki Gali. No mo ye herbal and traditional medical debe. Nti no Rwanda. And a minister to mo nkra se oba one mo betena se na ma hye na ase bi o bi amaka. Mo threaten say mo be cause strike. And a minister say mo ntwen Drew Ghana na ase bi o bi am one mo atena se ayede aka. Abushua minister say oti play more year transit every Rwanda abedu Morocco no and oti say we declare strike e wo Ghana e wo dachi we declare strike ni we mpanifo na declare strike no we am nyina mo tukwan kwa approach tie ni yewu mo tena Ghana declare strike ni we no mpanifo na mo declare strike we nyina mo kwa approach deliberately. The minister bedroom Ghana no leaders now also ne mo tena negotiation table ho ejojo no ne mo fa adwe no mo am declare strike no mo say to kwan mo ina mo kwa approach na ye de saade we chichiro mai eje boni na ndc aban de ayem ede ba asem ede ba de ede adia ade you can't do this in the abra akufo ado ye mampeni no betima ye saade we abra na akufo ado ye mampeni no wo betima ye saade we. You dare not. You dare not. Won't mean try. But when you have a government that we are humble, you take their kindness for their weakness. You turn out to blame politicians and a politician. These are civilians. These are professionals. Yes, sabotage your time. If you are approach, they are nowhere to be found. Now on your matter as a plan negotiate. And the say when you be a yasem, and depending 3 more day no what bone ten be our wechi. O bodia we are said to quine into womb when chimpo say what bodia. I brought when chile say what bodia no was said to quine. This is purely wickedness. You first answer seven kwasi asem when chile mine. Perpetua ofori ampof we ni pa bonini wo. Nyame be chiao.
Mo so near Ekosuni. Entino Adiachi, you see, public sector nurses are strike. And say nurses for and not doctors are striker. Why are they going to strike? They are going to strike because Sikasemni and those things you know already. Now Ghana ni biabedia dance you say. If doctors are going on strike, and I say, if nurses are going on strike today, it is not what has happened under this government in a mobile strike. Let us be honest with ourselves. Say, Kasabia, we make it to look like, say, oh, NDC government nearby and chair, how can they do this? Especially this dollar to CD exchange rate, assemble and dollar, no, who say no. Against the city, no. People said the NDC cannot solve it. But this health sector problem now and starting then. And then nurses for striker, NPP for a cookie story, no. They are making Ghanaians to believe, say, NDC government about in 5 months, yeah. And until Sadi way the air cost. Meanwhile, declare strike no grana see health minister in Ghana. That's all Rwanda, Kigali. Now, this is how Daily Graphic reported the story. And MPP for so terminate An ongoing strike by public sector nurses is taxing a toll on healthcare delivery in the country, with some major hospitals struggling to provide basic services as some of the wards have been deserted. A visit by the Daily Graphic to 3 major health facilities in Accra, Kolebu Teaching Hospital, Greater Accra Regional Hospital, Ridge and Adabraka Polyclinic revealed the extent of disruption caused by the strike which started yesterday. And the Daily Graphic for say strike no started no womaye afa to omuhusu say they will move to some hospitals around Accra. Omako Adabraka Polyclinic, Ako Ridge, Ako Kolebu. Na ne ekoso wo and reports from other regions also indicates that major health facilities in those areas had been affected by the industrial action. At Kolebu Teaching Hospital, the usually busy outpatient department was a shadow of itself. Many patients, some visibly distressed, sat awaiting for hours without being attended to, while others, out of frustration and lack of assistance, left the facility. There was a noticeable absence of nurses in the hospital's wards and consultation rooms. Only emergency cases and those already on admission were being attended to by some doctors and volunteers. One of the frustrated patients who declined to give her name said, "I have been here with my mother since morning, but no one has called us. No one has called us. We have not seen any nurses. How can a whole hospital operate like this?" At Ridge Hospital, the facility appeared to be slightly active. However, healthcare delivery was still significantly hampered due to the reduced number of nurses on duty. Some departments, including maternal care and general OPD services, had long queues and visibly frustrated patients. At Adabraka Polyclinic, the situation was quite different. Though the nurses' strike had affected operations there, the facility appeared to be more active. The administrators of the public, Yakubu Amidu, said they were doing everything possible to attend to the patient despite the challenges. Let me say this. I am pleading to the nurses now. Omako strike, yes, Remo. This current administration you're listening government, either is as a result of near air course so under the NPP and air affect and there, and I say as a result of near air course under NDC one, no problem. But for the sake of Encro for life into yes, Munko back Munko. That's all I can say. Adeba kwa enemy say life here back who are that's all. Death is forever. That's all. If you die, that's all. So, and a precious, we shouldn't joke with it. For the sake of uncrophone quantity, yes, Ramu, go back and work. We are pleading to you guys. That's all that I can say. Let's neglect the NPP jandam no more, you know. Throw no more chafa who cast stories. We have fired to now I am pleading to these nurses that they should go back and work, because imagine say Obi any operation, yeah, Obi surgery, Obi naya bu, yeah, be pam Obi crew, na yes a hospital in Yajuma. Do you think it's fine? And yet, na emergency you be able to a nurse hospital doctors na nurses in the and ye fair. And so for the sake of for life into no monko anything be hamubiano money government no be negotiate later. I think that will be the best thing you must do. Made the king fantastic. Yemfa asumbi entina Ghana.